Hi everyone, my name is Ayla Smallacombe. I am currently a fourth semester student here at the University of the Cumberland's ADN program. And today I'm going to take the time and just kind of show you guys whether you're in first level and just starting out, or whether you're in third semester and still trying to get yourself put together. Believe me, I've been there, I'm still there. So I understand the overwhelming feelings and all the stress. I get it. So today I'm going to show you quite a bit of some different things in the way that I personally, choose to study, how I take my notes, just kind of everything like that. So the first thing that I'm going to go ahead and pull up here is my ATI. So I'm just going to walk you guys kind of through what I do on ATI. Of course, mine is going to look a little different than your guys's, but ultimately it's the same thing at the end of the day. All right. So obviously you get to your homepage here, you get some of your recent activity, but then you're going to go to my ATI and you're going to see all of these different like tutorials, simulations, modules, all the things, right? And I know it's really hard starting out, just kind of getting used to ATI and learning how to use it and navigate it. But I promise, once you get to fourth semester, it's going to be your best friend. And it's super, super helpful. I've quickly learned that all of the work that I have done on ATI is benefiting me as a nursing student. So definitely take advantage of what you're getting, okay? So right now, for us in fourth semester, we are focusing on hematology and the endocrine system. So that's going to be located in the Engage Adult Medical Surgical RN. Obviously, for those of you that are in fundamentals, or whether you're in second semester and doing med-surg, peds, and mother-baby, obviously you'll have those modules listed on here. But for me, I don't have those on here. But for the sake of this video, we're going to go ahead and just focus on endocrine and hematology for right now. So we're going to go underneath the alterations in health, and we're going to go to alterations in endocrine function. So I'm going to continue my lesson. So what's really cool about ATI, when you open up your module and you get first glance at the content that you're looking to go over. So over here, we have the topics that are going to be covered in this module. You have videos that you can watch on it, which are really helpful. Or there's podcasts that you can listen to. Sometimes they'll have them within the reading for you, and you can just go ahead and listen or watch right away. But right here we have our topics, but I like to go to the lessons because obviously that's where we're going to start and that's where we're going to read. Now, going into this and seeing this, I see the little scroll bar over here and I'm like, goodness gracious, that's a lot of reading. But honestly, with all of the different questions and all of the different pictures and diagrams that they have, it goes pretty quick. So kind of taking a look here at the readings on ATI. So obviously it's really nice that we have the vocab here, because sometimes some students learn differently than others, and that's okay, because what works for you, it works for you, but it might not work for somebody else. So you have to really find what you like, and it does take a while, and you kind of have to adapt to your professor's teaching style for that. But for this, what I like to do is the ATI actually has a highlight function to where you can highlight all of the readings. So let's say that you wanted to have the definition of exactly what the pancreas is. So I would go click that color, and then it would highlight it for me. Now, how I do it is anything that I highlight on here is what I am going to write down in my notes, because I think that it's important to include, but also what I would think I would need to know to understand what it's also talking about. So as you can see, going through here, I've highlighted a bunch of different things, and just a couple of things from each of the different categories, like the anatomy and physiology and patho. It is important, but ultimately we're trying to focus on hyperglycemia, how it affects the patient, and how us as future nurses are going to treat those patients and care for them. So I still read all of this because it's all very valuable information, right? And I love doing these questions in the middle of it because it really does keep you engaged in the reading. So definitely take the time to do these each time you read, and it kind of reiterates that learning that you're reading. Also, these diagrams are really nice too. Sometimes the professors will include those on their PowerPoints. And so if they're taking the time to put it on the PowerPoint, you got to take the time to learn it and understand it. So definitely pay attention to some of these. But here, risk factors are a big thing. So you want to know what could put the patient at risk for developing hyperglycemia, like what kind of different things, whether it's their lifestyle or it's genetics, whatever the case may be. You want to know what those are so that you can help prevent the patient from maybe triggering hyperglycemia, right? So I always pay attention for the risk factors because those are really important. These orange boxes in ATI are also really helpful because sometimes they take all the information that is given above and they just kind of condense it even more. So it's really nice to have. So definitely pay attention to these as well. Comorbidities and complications. Obviously, we need to know because we need to plan for the worst case scenario that could happen with our patient. It might happen, it might not, but we have to be prepared as nurses for the worst possible scenario and just be prepared to be there for the patient and treat them accordingly. So anything that could complicate the patient in any sort of way, obviously you want to know that and you want to know how to treat that. So definitely just really try to focus on what your role is as the nurse to help the patient is, what could put them at risk, what's the impact on their health, what is that, if they're diagnosed with hyperglycemia or they're diagnosed with type 1 diabetes, like there's certain things that you as the nurse have to be able to provide for your patient that might not be just administering medications, right? So you really just have to kind of focus on that and understand that as you're reading. But obviously here they emphasize for hyperglycemia that it's the 3 Ps, and these are all things that can be seen in patients with hyperglycemia. Again, manifestations is a really big thing too because you want to be able to not only know for yourself, but you want to educate your patient as to what could happen or what are some signs that could indicate that they're developing hyperglycemia. So again, it's really important just to pick out the nit and grit of the information. Because a lot of this, like I said, it's good content and it's very informative, but sometimes you don't need to know all of this. You really just need to focus on what your professor is telling you to focus on. See again the orange box here, more questions. Clinical presentation. Obviously, that's how the patient's going to appear when you first see them, or something that they might report to you when they come into the hospital. So again, those are things that you're going to want to know and that are very important. And then lab testing and diagnostic studies, because you need to know what labs they're going to have, and you need to understand what the labs are going to look like in patients that have hyperglycemia versus hypoglycemia. So you have to be able to know the tests that are being given, but also how to interpret all of those lab findings. And what's really nice is that ATI kind of breaks it down for you here. At least for hyperglycemia they do, and sometimes they provide really nice tables, and they explain it in the reading. But again, it's picking out the information that is short, sweet, to the point, but you also understand. Role of the nurse, this is a big one right here. This is what you do, essentially. So obviously this is very important. There's a lot of good information in here. Pay attention to this section here. Sometimes it can be a little repetitive as far as what your role is as a nurse, but if you just read it and go through it, you'll understand and you can sum it up for yourself. All right. We've got individual factors, environmental, safety. Safety is a very, very, very big thing. It's the number one thing that we're concerned about with our patients, right? So you want to make sure that you are reading these, taking notes of them, whatever you do. Safety considerations, there's always going to be safety questions on your nursing exams, NCLEX, all of it. Patient education, another really big important section here, because you as the nurse have to be ready to educate your patients on what they need to do to help better themselves outside of the hospital. So again, really big section here, but read through all of it, pick out what you think is the most important, and then base that off of what your professor lectures in class. All right? And then the big one here is the nursing process. 9 times out of 10 on every single nursing exam, you are going to have multiple questions indicating or asking about some part of the nursing process. It is critical that you guys pay attention to this section, because I'm telling you, you will always have questions on the nursing process. And so these sections here really break it down for you. Again, short, sweet, to the point, but just pick out the information that you think is important and that your professor lectures on, and you'll be totally fine. And then treatments and therapies. Again, this is another big section here, but also pay attention to the specific things that your professor is teaching or lecturing about as far as treatment, because sometimes ATI can just really go above and beyond and talk about all these different like therapeutic procedures, which is very informative, but it can kind of be a lot and can kind of just can kind of just like add too much that you don't really have to worry about at the time, right? So now down here we've got all the different like medications and stuff like that, and it's really nice and interactive too, to where you can go and read all the different things. But that's how most of these readings are. And then sometimes there's activities, there's a summary, and there's also study tools too. But one thing I do also want to point out with this, so I'm going to go ahead and close out of this here, is at the end of these modules, so when my little window pops back up here, so after you get done with the module, okay, there is a test that you can actually take on the content that you read on that module. And I will tell you that these practice tests that they have at the end of that they have after the module, they're really good questions, because they're the application questions that you're going to see on your nursing exams. Obviously, it's not going to be the same questions, but it gets you thinking about what you're going to find on your nursing exams. So here we have the question: a nurse is educating a client who has been diagnosed with hyperthyroidism. Which of the following statements should the nurse include? So based on the reading, you kind of go through, and so we'll go ahead and select this. But what's really nice is if you get the question wrong, it tells you the rationale as to why those answers are wrong, and it tells you why the right answer is correct. So that's really nice, and you learn a lot from that. And so it's a really good tool, and you can always close out of it and go back and pick up where you left off too, which is really nice. Okay, while this is loading here, another thing that's super helpful, that's kind of annoying and it's kind of a lot, and do with it as you will, because everybody learns differently. But one thing I have come to realize in my 4th semester of nursing school is that there's a ton of different disease and system disorders and medications and procedures that people can go through, and it's really hard to try to keep all of that information organized. But I will say I am a big fan of these active learning templates. So this is on your ATI, my ATI. So we were just in study materials, hopping over to active learning templates. So you have all access to all of these. And I'll show you a couple of the ones that I use a lot of as a 4th semester student, or what I've just used so far. Obviously, you guys have probably seen these or will see these when it comes time for your proctored assessment remediation. So these will always be with you throughout your time in nursing school. You will never not see these, okay? But just to give you a quick glimpse at what some of my active learning templates look like. So this one is a system disorder one, and this is on DVTs. And basically in here, you've got the diagnosis, the patho, health promotion and disease prevention. Then you have your risk factors, expected findings, lab tests, diagnostic procedures, your nursing care, medications, client education, therapeutic procedures, interprofessional care, complications, and safety. So this sheet of paper here really sums up everything you need to know about DVTs. Now, obviously, the nursing process is not on here, so you will have to go and take notes separately, which I'll show you what I did too. But honestly, these don't take a lot of time to do, but it gives you the nit and grit of the information that you're going to need to know. And honestly, like I said, it saves a lot of time. But also, it keeps everything organized on one piece of paper, and you have everything you need for the information. So these are really helpful. Another one that I have is on Lovenox. And this is a medication card. I know some of the professors use different ones for when you guys are at clinicals or you're in lab and you're doing medications, but for medications that you're doing and seeing on ATI, this medication card template is really, really helpful as well. So you have your medication and what the class is, but there's also a module on ATI called Pharmacology Made Easy. There's a 4.0 and there's a 5.0. Whichever one you decide to use, they're both excellent at explaining and giving you all of this information. Like, all of this information that I put on here comes from that Pharmacology Made Easy. And you can actually pull up a drug table where it breaks it down even simpler than this. Because this looks like a lot, but this is straight from the reading and all the information that gives you. So that's what the medication card looks like. And then the last one I wanted to show you is on a therapeutic procedure. So one thing that we learned about that's really huge with hematology is blood transfusions. Those are very big, that's a very big procedure. It's very important, and it's very important that the nurse knows how it works, what to do, and what to do if there's possible reactions, and just needs to know the ins and outs about a blood transfusion. But again, you can find all of this within ATI, within the modules where you're doing your reading. And so you got your description of the procedure, your indications, considerations, outcomes, education, complications, and nursing interventions. And all of this, again, just organizes it so you have it on one piece of paper and you have it just summed up, ready to go and used for studying. Because honestly, this looks a lot more easier to study than trying to take the time to make a ton of flashcards and then trying to take a ton of time to handwrite notes. And it just all takes a lot of time. And as nursing students, there's never enough time in the day. Whether you realize that now or down the road, you guys will come to a point where there's just not enough hours in the day to get the work done that you want to or that you need to. And so these will save you a ton of time, but also, like I said, they don't take very long to write out or type out. And what's really nice is you can print these off and you can handwrite on them, or like I did, I typed on them. So we'll go for a diagnostic procedure here. So it pulls this up right away. It'll take you to a new tab, but what you can do is you can download it and it'll open it up in a tab here, but you can actually start typing on it. So you can go ahead and just like put your name, and then you can put, whatever procedure it is, and you can just go ahead and fill it out and type it out. And then once you get done, you can save it with your changes to your computer, and so you have it. So it's very, very nice to have, and it's free access to that. So definitely take advantage of what is given to you. The next thing I want to show is the assessments tab here. And on this tab here, there's a lot going on for me. I've taken a lot of ATI proctored exams already, so kind of just ignore those for right now. But for the sake of this video, we're going to go ahead and look at the dynamic quizzing. Now, your professors may have mentioned this, may not have. Totally up to their discretion, but this is a really good tool to do practice questions on again. So you've got the module test that you can take afterwards, or you have this. So once you take enough of these quizzes, it'll have like a rank and a percentage or whatever. As you can see, I've started a lot more of these quizzes and haven't really finished them, but I just do them so I can get practice with the questions. And let me go to another question. So what's really nice about these, is that you can actually look up the questions that you're wanting to have. So I'm going to look up hematology. And so we'll go here. And this is a question on hematology. A nurse is preparing an in-service presentation about the basics of hematology. Which of the following factors provides a stimulus for the production of RBCs? And so this quiz right now, I will say, is on study mode. So I'll show you how to set up your test in a minute. But what's nice about this mode that I'm in is, let's say we want to pick that answer. It'll tell you that it's wrong, but it'll let you try again. So let's try that answer. Nope. And so it'll keep going, but so you can see when you get the question right, but also you can see the rationales as to why that answer is correct and why the others are not correct. So it's a really good learning tool for you, and it gives you practice questions for what you're going to see. They also have a highlight function on here, so you can go ahead and highlight the information that you think is important. Or you can do a strikeout, like strike out those answers, which is really nice. So you can visually see the process of elimination, which is really nice. So, and then they've provided a calculator too. So this is just a really nice tool to have and to use, to again get practice questions and to go through those. Now let me show you how to start it. So back in here, so up here in the top left-hand corner, so you can do a quick start quiz, which is 10 unanswered questions, all subjects, study mode, or you can do custom quiz. I always do custom quiz. And so you can do an enhanced learning, or you can do like an NCLEX board exam, which is what you'll see on test day. I've personally not used this yet, but it's definitely there if you want to use it. Now, there's a test mode, and it breaks down each of the different modes that you can set it in, but I personally love the study mode because it shows you the explanations during the quiz. And so for question status, I just do all. For difficulty level, I do all. Question type, I do all, because obviously we can do multiple choice all day, but we have next gen questions that we have to do as well. Now the subjects. So we'll clear these. So obviously for our first semester, we've got fundamentals, right? So I usually click on the fundamentals tab right there. And then you can pick how many questions you want to do. Personally, I like to do 10 to 15 because it's just a lot easier to digest. And then once you have everything selected that you want on how you want to take your quiz, you can go ahead and start quiz. And it'll start giving you questions right away. So we'll go ahead and we'll do this practice question kind of as like an example. So a nurse is caring for a client who is receiving IV therapy via a peripheral catheter. The nurse should identify that which of the following findings is an indication of infiltration. So what I like to do if I'm going to highlight any information, I always like to highlight what I'm looking for. So we're finding an indication of infiltration, and we have to identify it as the nurse. So kind of looking through these options here, we've got the redness at the infusion site, edema at the infusion site, warmth at the infusion site, oozing of blood at the infusion site. So when you're caring for a patient who is receiving IV fluids or any IV medicines and a peripheral catheter, one of the biggest things you're going to want to look for is swelling, if there's any bleeding around the site, if there's anything abnormal. So we'll go ahead and select edema at the infusion site, and that's correct. So a lot of this, like I said, this is the fundamentals quiz. You can generate other questions by looking up specifically what you want to be tested on. But for the sake of this is just an example here. So you don't have to necessarily look for this question. But again, it's just a nice study tool to have and that you have access to through your ATI. And so obviously there's so much more on here that you guys can go in depth about and do on here, but definitely take advantage of what is given to you, just because this is a really good resource and it's ultimately getting you ready for the NCLEX, because that's our goal here at the end of the day, is to be ready and pass the NCLEX. So some other things here, this is just what my iLearn looks like. Obviously it can look a little different for each semester. Each professor is different, so just keep that in mind. But one thing that I strongly recommend to you as nursing students, so each professor in their syllabus should have a class schedule that they post in there for when your assignments are, when you have ATI exams, what content you'll be covering, everything like that. So they should include that in the syllabus. I highly, highly, highly encourage you to print this out, put it in a planner, whatever it is you do. This is very, very important to have, because this will keep you organized and you can update it. You know, life happens, things have to change, we got to move stuff around. It's nice to have this so that you can keep up with what you're doing, when your exams are, when your finals are, what content you need to be looking over, all that good stuff. So please, 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 in some shape or form, please have either a copy of your class calendar or have it in your syllabus. And your syllabus is located here under syllabus, and it'll take you to where it's at. And always check your iLearn, because sometimes your professors will put announcements on here, but you won't get the email that they put the announcement out until the day after. So make it a habit when you get up in the morning and you're getting ready to start work. Make it a habit to not only open your inbox in your Outlook, but also check iLearn for any announcement that your professor puts out, because sometimes they'll put an announcement out there but not send an email saying that they put it on there. Okay? So you really just have to pay attention to that and pay attention to your email. So obviously this looks a lot different. And so kind of just go through all of your content. Any handouts, anything that your professors give you, please print it out or save it on your computer, because they're not just posting it on there to post it on there. Like, they're posting it on there for your benefit, so take advantage of it. Any lecture material, I always download the PowerPoints. Any other material that they put on there, I'm always downloading it, printing it out, because they're incorporating that in what they're testing you on. So you want to be up to date and up to speed on that. And then for ATI, they'll put, what module you need to be looking at, all that good stuff. And sometimes they'll put up some optional assignments that you can do to help you understand the content better too. Again, they're doing that strictly for your benefit, guys, so please take advantage of that. All right, so that pretty much covers the ATI/iLearn portion. Kind of switching gears to kind of wrap this video up. So this is how I take my notes as a 4th semester nursing student, okay? What works for me is not going to work for everybody, but this is just what I can show you based on what I have done from reading ATI and then taking the notes. So I will preface this by saying I'm a very hyper-organized person. My folders have folders have folders, okay? Like, I am strict on my organizational skills. I thrive on organization. And you all should too, because that will keep you literally in check during nursing school, and it'll save your butt more than you know. So let's go to the week 1 content here. So I have my endocrine notes that I took, and then I have my nursing process notes. Honestly, not much different. With my endocrine notes though, so we'll look back at hyperglycemia. Okay, cool. So what's really nice is, And this is just the note app that I choose to use. I have GoodNotes, but there's a lot of other notation apps that a lot of students like to use or will use. It's totally up to you and what you're willing to pay for. But GoodNotes has always been really good to me, and it's very user-friendly, so I highly recommend. But anyways, so this is how I take my notes from the section that I'm getting it from. Let's see if I can zoom in on here. So here I have where I took my anatomy, physiology, and pathophysiology notes. And then where I highlighted that information, guys, I literally just wrote it down. Try to put it into your own words as best as possible, of course, but essentially what I highlight is what I write down. And, you know, definitions, anything that I might need to know as far as understanding the content. I do, for this particular one, I did write down the questions that were on ATI, those interactive questions, but obviously risk factors, huge thing to include on your notes. And you got your modifiable, and then you have your non-modifiable, and then your comorbidities and complications. Like, all of this stuff is so important for you guys to write down, impact on overall health. And I'm not saying you guys have to write a book of your notes, but this is just some good information to have. Obviously, you got clinical presentation, lab testing and diagnostic studies, role of the nurse is huge. And then you got your patient information or education. And then here is my nursing process notes. As you can see, it doesn't even take up a whole page. Again, I take what I need from the nursing process, get the general gist of each of the different things, and then I have my treatments and therapies, and that is it. It's 4 pages of notes. It looks like a lot, but it's really not. I mean, I've got this bullet list right here. And so it's really not that much, I don't think. Because before I was taking like more than 10 pages of notes and was running out of time to get that content all done. So yeah, big improvements here. And so I just take the nursing process notes that I have on this previous one, and I went ahead and just put it on its own. Sorry, this is so bad, but I'm using my trackpad right now, so this is as good as it's gonna get. So this is what I just grabbed from here. I put it on one page, so I had my nursing process notes to go along with my active learning templates. But I'm telling you guys, this is not that hard to do. And I have my treatments and therapies as well. The biggest thing about nursing school, and the biggest thing that I could say as far as advice goes, you get out of nursing school what you put into it. If nursing school was easy, everybody would do it, but it's not. Nursing school is far from easy, and you have to be willing to put in the work, to put in the time to understand and learn the content, because nursing school prepares you for the NCLEX. That's what nursing school is meant to do. And so you need to try to be the most absorbent sponge as you can from day one to your last day walking across for your pinning ceremony and graduation. You have to be sponges and absorb as much of that information as you can. But also, doing these active learning templates, you can use these to study for your NCLEX. These are yours. Once you download them, they're not going anywhere. So definitely take the time if there's certain skills, or if there's anything that is not making sense to you guys, or that you need to have some further teaching on. Do the active learning templates. Watch YouTube videos. Level Up RN is a really good YouTube channel. Nurse Sarah, she does a really good job explaining a lot of things. There's a lot of helpful videos and tools out there for you guys too, if you just take the time to look. But essentially, you guys, it's hard work from day one to your last day. And nursing school takes a lot out of you, but it's so rewarding once you get to the end. And so really take the time to focus on your studies. Make sure that you have a planner to plan out your days of when you need to study, and build in some time for breaks, because as much as you guys would love to keep studying all day and all night, you got to give yourself a brain break. I mean, you're going to start to go insane after a while, and then it's like more things just start to happen and it's not good. So definitely don't be don't be scared or upset or feel guilty about taking time for yourself, because next thing you know, you're reading through the modules and like 2 hours have gone by and you're like starting to go cross-eyed because all you've been doing is just reading about nursing content. So definitely take the time to take the breaks that you need and get some adequate rest, because if you can't get good sleep, if you're not eating right, your brain's not going to function the way you need it to. So definitely take care of yourself as well. Just kind of a closing statement here too. If any of you ever have issues where you need to talk to a professor or you might need some help, all of their contact information is in your Outlook. So you can go ahead and reach out to any single one of them at any time. They are more than willing to help you. But you have to be the one to ask for help. They're not going to come looking for you. You have to go and seek the help yourself, because that's the only way that you're going to learn. So if you guys are ever struggling on a topic, or you just need some clarification on some things, or if you just need some extra guidance on what to do, always refer to this video. I'm sorry it's really long, and thank you for sticking with me through all of the 36 minutes so far of this video. But definitely reach out, because if you don't communicate that you're struggling, your professors aren't going to try to help you, because they're already doing the best they can to teach the content, and they can't just stop to try to help one student understand the content, right? So if you need help, reach out to them. That is what they're here for. That is their job, is to help us, okay? And they are more than willing to help you. Don't be ashamed for asking for help. Also, we have a free tutoring center here on campus. I'll go ahead and show you the link to that, actually. So if you click on your module, there is this little tab where we have online tutoring. So being a student at Cumberland's, we get free tutoring. That's free online tutoring and free in-person tutoring. That's super nice. So this tab right here is the Learning Commons. And so it'll take you to the Cumberland's website, give you a little spiel, whatever. But you can email this tlc@ucumberlands.edu, and you can get set up with a tutor here on campus. Now, from what I understand, I know last semester we had a nursing student in the tutoring center. I'm not sure if we have one for this semester, but again, email this tlc@ucumberlands.edu, and this Dr. Coleman will do anything and everything she can to try to match you with a tutor or point you in the direction of online tutoring. So definitely take advantage of all the resources that you have, okay? Again, it's up here too: online tutoring, Learning Commons, library resources, all that good stuff. So definitely take the time to kind of explore your iLearn, your ATI, and just figure out what works best for you. Because once it starts working, there's no stopping you, right? So that's pretty much all I have for this video. If you guys want me to do another video kind of showing my process when I'm reading and doing notes, or if you genuinely just want to get together and try to talk about some things, I'm always available too. Being a fourth semester student is definitely difficult, and I'm also a student athlete, so that's also kind of hard. But I do try to make time to meet with people that are struggling and just try to point them in the right direction. But hopefully this video kind of gives you enough of an idea of what you can do with the resources that you're given, okay? But yeah, that's it. Thank you for sticking around for the basically 40 minutes of this video, and I wish you guys nothing but the best of luck, and you guys can do it. If I can do it, you can do it. It's hard, but like I said, if nursing school was easy, everybody'd be doing it, right? So you guys are here, you made it, you're doing great, and be proud of yourselves, because you guys are already working so hard and doing all the things you can do. But you guys got this, and thank you for watching.